Hi.
I'm a first year student and I'm having a lot of troubles understanding like social history and like its importance and relevance in the cardiac and respiratory assessment. Like I don't even understand like what is social history.
Yeah, well, so social history gives the paramedic and medical practitioners an understanding of the patient's lifestyle. The patient's lifestyle could be looking into the alcohol, drugs, diet, exercise, travel, smoking, peer group illness, hobbies, and pets. Like each one of these aspects of their lifestyle can affect their health in some way or another. They also can give indications about the severity of illness, the acute or chronic illness, secondary infection disease. To ensure that a paramedic gets them all properly done, they have to ensure that they go through the whole thing. If they miss out little bits and pieces of it, then it creates a not as accurate diagnosis of the disease and more room for error in the long run.
Yeah, so what are some of the social history indications of the respiratory assessment?
So the negative indications between the cardiac and respiratory assessments are different between them both. There's certain lifestyle habits that can increase the illness of the patient. Some of these in the respiratory assessment, which are the predisposing factors, can be smoking, whether that's tobacco or illicit drugs, marijuana, vaccination history, travel, and peer group illness. It's essential to assess these all properly to help connect the dots. Like if I'm assessing the patient and I say, have you smoked before? And the patient replies yes. Instead of ending it there, you just go into more detail and go, okay, for how long? How often? How much a day? Just by knowing these, it creates a timeline for yourself to see when it started, when it was set off, how bad it could be, and yeah.
Yeah. So, what are some of the negative social history indications for the cardiac assessment?
So the cardiac assessment involves smoking, cocaine, IV drug use, alcohol, and occupation in the official assessment. And each factor of these present differently to the patient, and that's why it's so good to know as a paramedic the signs and symptoms that a patient could be presenting with for each one. It makes it quicker to diagnose and more effective in the long run. But primarily, the diet and exercise of the patient can cause many negative effects to the cardiovascular system. Some of these effects may be atherosclerosis, high blood pressure, increased heart rate, disease, and secondary hypertension. 30% of mortality in men and 60% of death rate in women is caused from lack of exercise, which is pretty high considering. And the cardiovascular disease is so high in mortality rate. Poor dietary, such as eating salt and high fatty food, can cause atherosclerosis from buildup of plaque in the cardiovascular system, which in the long run causes heaps of harm to the patient. Most of the time, if you treat an obese patient, that's always something to look out for. ECGs are primal.
Yeah. So, just to to sum up, why is it so important that you have social history a part of these assessments?
Yeah, well, basically, so social history is obviously all about lifestyle, and often the lifestyle of the patient can indicate the health of the patient. So if a patient let themselves go, it could be laziness, but often if a patient is obese, if they're unclean, if they're unclean, sometimes if their household's unclean, it can give a good indication that they don't care or they are too sick and don't feel well enough to treat themselves. It also gives an insight into presenting symptoms, which helps accurately diagnose a patient. And it's good to understand the cause and effect of the illness and disease.
Okay, thank you.
That's all good.